Today we'll be examining how to take a periapical radiograph for endodontic treatment. First thing you want to think about is the sensor. It's very high quality. However, it is a very stiff sensor. It's not flexible. It's not the same sensor that we use in urgent care or on the second floor. Just remember the sensor is very stiff. When you look at the corner, it can also hurt the mouth. So it's important to recognize that when placing it for patients. So when taking the radiograph, it's important not to push the sensor necessarily close to the teeth. It's not as effective when you just push it to the teeth. It's difficult to get a vertical angulation. It can hurt the patient. You want to place the sensor into the center of the mouth and take advantage of the palatal space. As you can see here, you can place it away from the tooth, and then you can change the angulation as seen. Once you've got the angulation correct, you can place the X-ray tube in the center, and then you can take the radiograph. Let's say for the maxillary first molar and second molar, the palatal root is angled this way, and the mesiobuccal and distobuccal root can be angled so that they're divergent. In this case, when you take this angle, it sometimes can be difficult to see the palatal apex. So how would you take the palatal root since it's so diverted? You want to make sure to follow the angle, as you can see. Then you can see the palatal root and then make it a more acute angle. Then bring the X-ray tube, as we can see in the video. We'll bring it to a more acute angle, more vertical acute angle. And this will allow us to capture the palatal root. However, it's important to remember when you make this acute vertical angulation and you have deviation to see the mesiobuccal, distobuccal root, it's important to verify the working length. To see the mesiobuccal, distobuccal root for your working length in a complete radiograph, for example, the master apical file radiograph, you'll want to take it as shown in the video. So it may be important to take 2 vertical angulations for the mesiobuccal and distobuccal root as well as the palatal root. Now we'll go over how to take premolar radiographs in the maxilla. Again, we want to remember that the sensor is very stiff. It's difficult to place the sensor directly next to the teeth because of its rigidity. So you may not be able to see the premolar exactly. It may be on the side. So how do you get it pictured directly in the center? Again, we have to use the palatal space. So we can place it into the palate and then rotate it to achieve a bisecting angle radiograph. And then we can angle it, a vertical angulation, and then have the X-ray tube directly angled towards the center. By doing that, your premolar will be in the center. Also, we may be in the situation where we need to determine if premolars are single rooted or double rooted. So when you're taking the radiograph with this angulation, it's not necessarily visible with the angle that we're showing. So it's important to take the radiograph at an off angle where we shift the x-ray tube measly in this situation. So if you take it measly the first time, you'll switch it distally. It may even look like that you're taking it directly at the canine, but this off angle will give you a visualization as to where it's single or double rooted. Now we'll shift to radiographs for mandibular molars or premolars. It may be a bit more difficult. So now we're dealing with the tongue that can make things more difficult. So when you put your sensor, as we're showing in the video, first, it's very important not to put your sensor on the tongue. You can't just push the tongue down. You need to identify where's the location of the tongue and identify the lingual space, and then place it correctly into the lingual space. And after that, expect that when you push down, the patient may react. And it may not necessarily be the patient reacting. It's really the mylohyoid muscle reacting. It's just a very common reaction. So when you push it down, be gentle with the patient. It's very common. Mylohyoid muscle pushing up and then can dislodge the sensor. By the time you press the button to expose the radiograph, you may realize that the sensor is already pushed up, which often will just give us the view of the crown, which is not helpful in endodontic therapy. So what you can do is very gently push down. And Dr. Zhang's personal tip that he has to offer us, using your thumb to push it down, is he'll stand behind the patient and gently just tap them on the shoulder. Just please relax. In a very gentle, calming voice. You know, it's difficult. It's to relax in clinic and patients are stressed, but if you give them just that affirmation and just a soft pat, it can really help them relax. It's not 100%, but it is a very helpful technique. So when you're pushing down, just give them a soft tap on the shoulder and then gently push down. Once you have it placed, you want to have the x-ray tube already ready in the location. Make sure it's in the area where you're taking the radiograph. Allow the patient to hold the sensor with the Crawford stick holder. But even 5-10 seconds, you'll see the sensor will almost always inevitably go up. So it's important to make sure you have everything ready, switch next to you, and once you press the button, that everything will be captured. Now we're looking at mandibular premolars. It can, again, be very challenging. So when you look at the arch, it's much narrower than the maxillary arch. And you also are dealing with the tongue. The lingual tissue, it's pretty sensitive and can be painful. So again, you want to correctly find the lingual space, making sure that the tongue is not pushing it away. So you place it in the lingual space and then you rotate it, just the same as you would with the maxillary premolar. So once it's rotated, you can see this view. Premolar will be located in the center. Once you rotate it, go ahead and capture the radiographic image. Lingual tori can make it difficult. A very large tongue. You can't necessarily place it right next to the teeth. However, you can place it vertically. Again, you may need to rotate it. And then go ahead and capture the radiograph. Again, once you have it rotated, the X-ray tube angulation won't be straight on, but you'll have a perpendicular access to the sensor, which almost is seemingly from the front view, like you're going at the canine. So here, we'll talk about the SLOB rule, same lingual, opposite buccal. So when you're doing root canal therapy, you've got the access opening, and to measure the working length, you have your hand files in the mesiobuccal. So to clarify, we're talking about the first molar here. You have your hand file in the mesiobuccal, mesiolingual, and distal or distobuccal, distolingual. So when you take this radiograph and you have the mesiolingual, then you have to instruct the patient to continue holding the sensor. We need to take one more radiograph and have the patient continue to hold it in the same location. Then you need to shift the X-ray tube a little more distal or a little more mesial, whichever way was the opposite from prior. By shifting the X-ray tube, where you had the mesiobuccal in the initial image, and then you have this will allow it to overlap from the mesiobuccal to the mesiolingual, and whichever direction that you moved the X-ray tube, you're able to determine which one is the mesiobuccal versus mesiolingual.